United Nations AIDS or UNAIDS has released a new report stating that for the first time the scales have tipped. More than half of people affected by the virus now have access to HIV treatment, and AIDS-related deaths have almost halved since 2005. In 2016, 19.5 million of the 36.7 million people living with HIV had access to treatment, and AIDS-related deaths have fallen from 1.9 million in 2005 to 1 million in 2016. Now, if the trend continues, it would eventually put the world on track to reach the global target of 30 million people on treatment by the year 2020. The report also shows that new infections from HIV, which cause AIDS, have almost halved in India over the past decade. India had 2.1 million people living with HIV at the end of 2016, with new infections falling to 80,000 in 2016 from 150,000 as compared to 2005. Well, the region showing the most progress is Eastern and Southern Africa, which has been most affected by HIV and which accounts for more than half of all people living with the virus. All right, and to discuss more on this, I have with me in the studio Dr. Sangeeta Sharma. She is a researcher on HIV and also a PhD in social work. She's come up with a study of persons living with HIV, AIDS, problems and solutions. Dr. Sharma, thanks so much for joining us here. Let me start by asking you, we heard the good news. Now that's commendable, but I want to start straight away by asking you the bad news that comes for India in this report, which is countries of India, China and Pakistan are among 10 countries in which nearly 95% of new cases of HIV have been reported. Now this certainly is a cause of worry. How do you look at these numbers? I mean, comparatively, is the overall situation better, or is there still reason for worry for people in India with HIV?
Well, actually we are though the good news is there, but then we are still not in a state of complacency because of a lot of reasons, like, in fact, yes, numbers are coming down, and hats off to the efforts of NACO and the paramedical structure that they have come up with to combat AIDS. And I would say that community engagement has worked a lot towards achieving
NACO,
this. National AIDS Control Organization.
National AIDS Control. Right.
In India, National AIDS Control Organization has been working tremendously, and it's reaching out to the people who actually need that kind of an intervention. And I would say that, but still, there is I mean, we cannot be complacent with this kind of a scenario.
There is still a huge gap.
There is still a huge gap, and a lot of challenges are yet to be faced.
What are some of the challenges, if you can highlight for our viewers?
Yeah.
I mean, there is enough awareness over the years,
right,
but to achieve those targets, what are those gaps that need to be bridged?
See, I'm a social scientist, basically. So I look at this problem. This is, apparently it looks like a medical problem, but actually this becomes a personal tragedy and a family tragedy, because of the stigma attached.
Right.
Because it has a stigma of morality, it has stigma of contagion. So because of those stigma and discrimination, what is happening is that people are not coming out with the tests. So every single test that is reported, it's more like a tip of the iceberg.
Right.
So because behind one such test, one such person, there are a huge number of people who might be carrying the infection. And the irony with this infection is that it is not at all symptomatic. So because it is not symptomatic, so what happens that person, there is no symptom, I mean there is no treatment, there is no worry, so nobody does anything about it. And if the behavior is risky, one keeps on infecting the other. Second point is that in India, though we are combating HIV, but then in the matters of sex and sexuality, we are still very conservative, and we don't discuss those matters with our kids, with our young people, and the
right,
people who are experimenting with their sexuality, and we are still marginalizing homosexuals.
Right.
And
So
transgender.
it's a deeper issue.
It's
it
a much
involves
deeper
change
issue.
in the mindsets, a societal change in perspectives as well. But let's now look at the bright side of
Right.
it. The situation seems better
Right.
if you compare it from the year 2005,
Exactly.
especially in African countries, which has been a cause of great concern. That's definitely a positive. But the targets that are 30 million people on treatment by the year 2020, do you think those targets are realistic now and achievable?
Well, yes, why not? They are very realistic, and in fact, WHO also has come up with guidelines of 100% universal coverage of HIV positive people with ARTs. But in India, because it's a resource constrained setting, so we are we are controlling it. And the good news with this is because when a person is on ART, his transmission rates gets reduced by 98%. So the person.
Will you elaborate a bit on ART? For our
I'm so
viewers?
sorry.
Right.
It is antiretroviral therapy which is given to a HIV positive person, and once a person is on antiretroviral therapy, his transmission to the other person in any kind of an episode gets reduced by 98%.
All right. All right.
So this is
it's a
one of the-
comprehensive way of treating,
Right.
reducing the risks of it being transmitted to the other
Right.
person.
Besides that, we as social scientists are working a lot on behavior change, behavior change communication and enabling environment and the stuff like that. So lot of people are involved, and this is one program of public health which has actually had the community engagement to the core. The commodities are provided by the people to
Right.
the HRG, that is high risk group persons, at their doorstep.
Right. Also, Dr. Sharma, I wanted to bring out a point which I have been thinking about. As India, a country with so many professionals and all sorts of medical facilities, India is a country which is known for medical tourism. People from other countries come to India for taking treatment. Where are we lacking in terms of providing access for treatment for people who are infected by HIV virus? Where do you think India is lagging?
Well, actually, India is that way. We have come up with the very, very strong network of health network, particularly in the area of HIV/AIDS, because we have ICTC centers, integrated counseling and testing centers, and then we have PPT-CT centers, that is prevention of parent to child transmission. So those PPT-CT centers and ICTC centers, so people who are in high risk or the pregnant women, they go to those centers and they get themselves tested, and
Right.
every tested person, the couple counseling happens, that the pre and post test counseling happens. So I don't think that in any way we are lacking in accessibility, but the point remains again with the person himself.
Right.
If it's a woman with the children, she may not be in a position to go. If it's a migrant laborer, he may be more bothered about his wages, and that's why he's not approaching. But from the government side, well, I don't see that there is any challenge. I mean, it
Okay.
is very, in fact, we have opened clinics, at the NGO level also.
All
So
right.
that way, it's actually very, very wide network that we have provided.
So with time, maybe more awareness, more education will help all these
Stigma
people
could
to
be
come
one
out.
thing, that
Right.
people are not accessing those. Stigma could be one. Then they have their other routines,
Right.
like transport cost. Again, comes up heavy. Then wages, loss of wages, loss of man hours. Women not being able to, because here migrants are living in a nuclear family setup.
Right.
So they don't have a support system to take care of the kids and kids. So
Also,
those are the
Dr.
things.
Sharma, you mentioned earlier one of the ways by which treatment is done, ART. Are there any other treatments or medication that one can take if one has infection, is infected with this virus,
Well,
or
actually-
is this only ART?
Well, actually, antiretroviral treatment is given to the person while person is HIV positive, and during the progression of the problem, person develops lot of opportunistic infections, that are OIs. So side by side those treatments are to be given, but the point is that people have to share it with their doctors that they are positive and they are on ART, because sometimes there may be some complexities.
And what is the cost of treatment?
Well, we are providing it free of cost.
All right.
Yes.
And it's not that expensive.
It's not
Even
expensive. In
mostly
fact, it
provided
is
by the
it is
government or
free of
NGOs.
cost.
Okay.
Yeah.
All right. So Just for the viewers, putting things in perspective, we are talking about this UN AIDS report, which gives a positive outlook for the world, talking about having 20 million people who do have access to treatment for HIV. And Dr. Sharma here with us in the studio is throwing more light on the treatment available, the numbers, the outlook, because India is still one of those 10 countries where 95% of HIV infections have been reported. A little more detail into this the journey of India. We started fairly late in this, and then the biggest challenge was still educating people, making them aware of what AIDS is, and the government played a huge role in that over the years. Give us a sense of the journey and how far we've come and how much more road there is which is to be covered.
Well, when we started it, like it's somewhere in 1986 that we came across with the first case of HIV positive sex worker in Tamil Nadu. And from there, that sample was sent abroad by Sunidhi Solman, Dr. Sunidhi Solman. She's no more. So at that time, that was the first case, and we just thought that maybe she had a contact with some foreigner, and that is why it is there. But gradually, we came to know that no, we have to look at it. And initially, our politicians, our policy making people were more in a denial mode because of the our cultural system, our cultural norms, which are not very much in favor of speaking openly about sex and sexuality.
Right.
So what they felt was that since India is a highly moralistic country, we are not likely to have any.
Right.
But it was in 2005 then that we were slapped with the huge number, the biggest. We had the biggest number of HIV positive person in 2005.
Right.
So that is when we felt. But by that time we had already established National AIDS Control Organization somewhere in 90s. So National AIDS Control Organization with its National AIDS Control policies and control programs, NACP 1, 2, 3, 4. We are in 4th stage now.
Okay.
It has come across with lot of programs. Initially we were keeping high risk group people and as well as the bridge population. So there are like two kind of population. One is key population.
Okay.
They are the people who are sex workers, MSM and intravenous drug users, and then we have
So the
bridge
journey
population.
began from 2005.
No, it began in 1995 when NACO was
1995.
established.
Right, but then India played an active part after the
Very
numbers came out in 2005, and the
Yeah.
census we have is from these numbers.
But then
from
we can always
2006.
we can say that our methodologies of calculating were not very robust.
Okay.
So later after this 2005 declaration on 31st of May, I believe, we came up with more robust methodologies and more sentinel survey
Right.
of the HIV positive tests, and then we came across with the number, and then we came down with the prevalence also.
All right, and the efforts paid off.
Yes.
Dr. Sangeeta Sharma, thanks so much for joining us. Pleasure having you on the show. Thanks for enlightening our viewers and throwing more light on the state the stage at which we are in India and other countries around us also as far as fighting the HIV is concerned. With that, I'd like to thank Dr. Sharma and slip into a very quick break. Catch all the entertainment news which is coming up on the other side with my colleague Sejal. Stay with us.